Hey, have you gotten a neck or back MRI after an accident and you try to pull it up and you're looking at the screen like, what the heck is this? Is that normal? Is that supposed to be there? Well, in this video, we're going to go over what's normal and what's not. My name is Anthony Wade. I'm a physician assistant, and I've been going over neck and back MRIs for almost 20 years now. I've worked in spine surgery and currently working in orthopedics. And I've looked at tons and tons, thousands of MRIs over the years. And one of the things that I love to do is pull up images for my clients and go over line by line what's on the report and what's on the actual images to show them what's going on. What I find the most is when people get to see exactly what's going on in their body, it relieves a lot of fears. It helps people to realize that they can move forward with their recovery, and it just clears up a whole lot of mess that's out there. And, a lot of times people will try to read their own MRIs and they will pull up the images from the disc and sit there looking at a black and white screen with a bunch of blobs and dark spots and wonder like, what the heck is that? What am I looking at? So in this video, we're going to try and clear some of that stuff up. Unfortunately, I don't have your video in front of me, or should I say your images, and I can't show you exactly what's going on your report. So this is like the next best thing. But if you're interested in having me review your images, then I'll, leave a link or something for you to find out some more information about that. So let's get into it. I have some images prepared here, and I just want to pull these up. Let's see what we got first. So when you get into an accident, let me hide this for a second. When you get into an accident and, a lot of times, or slip and fall, first thing you want to do is go to the emergency room, especially if it's a big major car accident and you're injured. You want to go to the emergency room to get yourself cleared, make sure everything is all right. Typically, they will do x-rays on you, but not all the time nowadays. The gold standard is CT scans, but the old x-rays will tell you a whole lot of information, and that's something that you do want to get done. If not in the emergency room, or try to go to urgent care, or maybe you're a primary care doctor or chiropractor or orthopedic doctor, somebody, you want to get cleared and make sure that everything is all right. So let's take a look at our first image, which is an x-ray of the neck. So let's pull that up again. So on this image here, you're basically, of course, this is your jaw here and your teeth. The back of your neck, of course, is over here. The front's over here. This is your throat and your windpipe here. This, of course, is the spine. These are the vertebra, the bone blocks that are sitting here, and they're pretty much like, again, like a block. In between the blocks, what you can't see is the actual disc. And again, well, when you're getting x-rays show mainly just the bone, as you can see here. And it's very important to see the structure and make sure everything is lined up properly and things are not shifted or out of place. And I think I have some videos, or excuse me, some images here of some things that you should not see. But this looks pretty normal. The bones are pretty much lined up with each other. So this is like a normal view of an x-ray. Take that off. So that's something that you should see after an accident. Get an x-ray of your neck or back, wherever it's hurting. And what we're looking for is any fractures in the bones or any dislocations, things just out of place. So let's pull up an x-ray of the back here. Now this is a side view. This is like looking at you from your side. This is looking like straight at you on the left side, my left side. So again, everything looks pretty much lined up and proper. There's a lot. You could also see in this one some of the ribs here. You can see some of the intestines and all that. For the purpose of this video, we're not going to get into all that, but we're basically looking at the bone structures. And again, they're like blocks sitting on top of each other. And again, all this looks pretty good. Uh, one more time, what you don't see is the discs that are in between the bones, but everything looks to be lined up properly. And again, this is an X-ray of the lumbar spine. You have five vertebra of the lumbar spine. You have L5. I'm going backwards. L5, L4, L3, L2, and L1. This is the sacrum and is pretty much fused. We call that S1, but that's just the beginning there. But anyway, that's your normal X-ray of the neck and the back. So uh, this next image I'm going to show you is just an example of something, the reason why you want to get at least an X-ray done of your neck and back if that was injured in your accident, because a lot of things can happen that are under the surface that you can't see. Of course, if you got a broken bone or something like that, and or it's of course if it's sticking out the body or something like that's obvious, but you can tell, you get a broken bone, there's going to be some bleeding in the area. It may swell up. It's going to be very painful. But sometimes you can get cracks and fractures that are slight and subtle, and you just can't tell by looking at somebody. This next one here is something really interesting. And I don't know if you can notice just by looking at it. There's some words written there, they're a little blurry. Excuse me for the film. This is just one of the ones that I picked out that I thought was kind of pictured what I was trying to show you the best. So this is the base of the skull here. So like the bottom of your skull. The person's face would be out front here. This is like the edge of their jawbone here. Of course, this again is the spine, your neck, the spine of your neck here. And this appears to be a child or something. These bones look really small for me, or I would assume that it was a child. But the big discrepancy here in this picture is this spacing in between here. That is not supposed to be so. All right. This is what we call Atlanto occipital dislocation. What I like to call it is an internal decapitation, because basically the neck has been separated from the head. The only thing is it hasn't, completely separated on the outside, but on the inside, it is separated. And this will require some surgery to put this back together again. A lot of times what they'll do is they'll put a metal plate running from the base of the skull along the bones here with some screws and whatnot to hold everything in place. But this definitely is a medical emergency and requires surgery. So again, there's things that can happen on the inside that you cannot see. Things that are happening on the inside that you can't always see on the outside. So you want to make sure you're getting proper imaging and you're finding out what's going on inside the body so you can rule all that stuff out and have a clean slate and keep it moving. So our next one, let's see, what is this? So this one's something that I saw. That's one to kind of throw it in there. So this is what we call scoliosis. Scoliosis is a condition that can happen where the spine actually resembles an S curve, as you can plainly see in this film here. The thing that's interesting about scoliosis is it can develop over time. And for some people, now this is very dramatic. It's really obvious, and you may be able to see this. Definitely, some of these other ones here, looking at the person, you can see that something's not quite right. They're a little shifted to the side, but this can also be very subtle. And sometimes, a lot of times, people will have. Let me get this off. A lot of times, people will have a little slight scoliosis going on. And the reason why I put that picture in there, just to kind of show, sometimes when you're looking on the outside, there's things going on the inside that you can't see. And just a little extra in there, when a person has scoliosis, a lot of times, they might not even know about it until they get an X-ray or MRI, or if they get injured, usually that leads to the X-ray or the MRI. But sometimes when you have scoliosis and you get injured, all that stuff gets uh, uh, shooken and pulled, stretched, or torn and stuff like that. You'll get a lot of inflammation in the area, and something that never was bothering you before now is starting to bother you. And if you have a typical spine that's a little bit more straight, uh, they might be able to take or withstand a little bit of jerking back and forth. But somebody has a curve in their spine already has some alterations to their structures, and when you get into an accident, things get jerked around and pulled, stretched, and torn. You'll get some extra inflammation, and you have a little bit of an extra problem because your spine is not straight as most people's are. But again, those are those little things that you need to pick up on, and you can only pick up on those things sometimes is when you do an X-ray or MRI. So we've been looking at a lot of X-rays. One of the other images that people can get after an X-ray, after an accident, is a CT scan. So let's take a look at one of our CT scans. Now, this one is of the lumbar spine. And again, it looks similar to an X-ray, but a little bit different. Again, you can see the bones here in this CT scan. You can, I don't know if it comes out that well, but there's a little shadow of the disc that's here. I can see it. You got to look real closely, but it's a little shadow of the disc. Again, CT scans can pick up a lot of fractures and whatnot. It shows the bone in a lot of good detail. And you can also see some of the soft tissue, but if you really want to pick up on the soft tissue, you have to get an MRI. But again, bones are sitting right on top of each other. This all looks good. This is your spinous process in the back here. That's the bony structure you can feel up and down your spine. Your spinal canal is here, and your spinal cord would run through this spinal canal. This here is is basically like chopping your body in half horizontally and looking down. So the person's back would be back here. This is the spinous process. Again, the bony structure you can feel up and down your spine. Your stomach would be up here where the blue part is, and further up though. But this is the bone here, and again, this is your spinal canal. Your spinal cord would be in the center here. The disc would sit right on top of the spinous process here, or your sitting right here on top of the bone. Excuse me, mixing up my words. So that's where the disc would go. So that's a normal CT scan. So let's look at something a little abnormal when it comes to the CT scans. So let's stay here. Again, this definitely is abnormal. This is what you'd want to pick up on. This person has a fracture, multiple fracture here of this spinous process, and you can see all the cracks in the bone. The spacing for the spinal cord is supposed to be here, but right in here is probably where the spinal cord is smashed. All of this has pushed into the spinal column or canal here, excuse me. And again, this is not good. Here's a side view of it. You can see the fractures here, the bone again sticking into the spinal canal, which is here. And again, this is something that you definitely do not want to miss. It's obvious, and this person will need some surgery to fix this problem. But these are the things that you want to pick up on when you're getting X-rays and CT scans. It's the reason why they get them. Unfortunately, I'll get some patients come through that have not gotten any images, and they're coming to see us, so we'll get them done. This is at my clinical practice, but I'll talk to people that have not gotten any images, and I'll let them know that that's something that you need to get. You want to make sure everything is all right, and You have to get an order for those. So you're going to need to see some type of provider at a urgent care or, of course, emergency room or orthopedic doctor. Even chiropractors can order MRIs. A lot of times they have their own x-ray machines, so they can shoot the x-rays right there in their office, and will give you some the information that you're looking for on the x-rays. So let's keep it moving. Let's see what we got here. All right, so this is a little bit more of the same, but a little different. So again, your back's back here. This is an MRI, by the way. Your back's back here. Your stomach would be in the front here. This is the spinous process you see here. This is your spinal canal with the spinal cord. The white area is fluid that's supposed to be there. This is your actual spinal cord that runs through the back. These are the bones of your spine, of course. And as you can see, this looks all good. You got the disc material that's in between, that's dark. The problem starts when you get down here. This is a crush injury. The bone has crushed down, and as it crushed down, it actually tilted forward. The top part of the body shifted forward. And again, this is happening at this level as well. This is a crush injury, and but things are sitting right on top of each other. It hasn't shifted like they did up here. But these are the things that you definitely want to catch on an MRI. This person, should have gotten an x-ray first. You would have seen some of this detail as well. And, the correct measures would have likely have taken place. And this person's probably headed for surgery. But we needed to get an MRI of I say we, like I've seen this patient. This is just a picture off the internet that I just wanted to show you guys. But you see a little bit of the disc material sticking out here, and the spinal cord slightly compromised, but it's still there. This also sticking out here can be dangerous if this is unstable. But again, these are the things that you want to find out and you want to get images for. So let's move on to the next one. Let's see what we got here. So this, again, is a little bit of scoliosis. And this is an MRI of a person with scoliosis. This view here is the side view. It's a terrible picture, but part of the reason is because how it looks here. This is not a good picture anyway. Pay no attention to this side. Look mainly at this side. This is actually a front view that's looking straight at you, at this person. And you can see up here, things are starting off pretty normal. You have the disc here. Again, things start to curve at this point here. The problem that you can have is that you see how this side is I guess you could say kind of normal, but the disc material is sticking out on this side. Now, off to the sides, there's not a whole lot of things to worry about, but it's when it's sticking out towards the back when you have problems. But what you can't see here, it's a different view that we'd have to look at that I don't have a picture of, but the nerves that come off the spinal cord on this side will probably be a lot more compromised. It's smaller openings for the nerves to come out. On this side, the nerve openings will be a lot bigger. I'm bringing this up, but I can't show it to you on this type of film, but I just wanted to show you how it looks on the MRI of a scoliosis. So our last and final one, let's get to this here. So on this side, again, you have your spinous process in the back here. You have your spinal canal, the white area, the fluid with the spinal cord, running through here. Once it gets to a certain point, the cord starts to turn into like a horse tail. There's little pieces of it that just spread out like, again, a horse tail, or think of a broom. You got the broomstick up here, and then the brush part of the broom sticking out here. That's your spinal cord. But again, what we're looking at, I believe this might be the same patient before and after, but I could be wrong, but it looks pretty similar. But again, you got the bone block sitting here, you have the disc material. If you notice, you see the color in here is a little bit lighter and then it gets darker and darker. That what's happening there is the white areas because there's fluid inside the disc, and as it collapses down, the spacing starts getting less and less. It starts to dry out. When it dries out, it turns dark. What I wanted to draw your attention to is this disc material sticking out right here. It's sticking out a little bit. This here may be like a bulge. It kind of depends. We'd have to look at a couple other views, but this may be a bulge. This is more of a herniation sticking out here. But when we flip over to this side, this picture on this side, again, the disc material everything looks good. It's nice and white. Yeah, again, you have your spinal cord that runs through here. As it gets down here, things start to collapse down and the color changes. It starts getting dark. And this, where the disc is sticking out a whole lot, this is an extrusion. This right here, protrusion, this one, extrusion. The difference, the best way, let me take this off here. The best way I can explain it is like a tube of toothpaste. You grab a tube of toothpaste and you squeeze it on both sides and you get a little bump in the middle. That's like a bulge, just a little bump there. Bulges can happen, that's normal. But then let's say you grab the tube of toothpaste again and you really twist and crank it and push it in a little bit. It's gonna that material in the middle is going to stick out a whole lot more. That's more of a herniation. Sometimes people call it like a slip disc and stuff like that. It's more of a herniation or protrusion where it's sticking out. Now, if you really want to make things bad, take like a razor blade and slice down the middle of that tube of toothpaste and then crank it one more time, and the stuff is going to stick out even more. That is what's happening here. The disc material is really sticking out a lot. It's pressing on the spinal cord here, and this is what we call Cauda equina syndrome, where the spinal cord is being compressed down at the bottom. You can have loss of bowel and bladder, meaning you poop on yourself or you pee on yourself, and it's uncontrolled. It just happens. That's a medical emergency. That's something that you want to definitely get yourself checked out for and go to the emergency room. It requires surgery. But again, these are the things that you need to pick up on your MRIs and your CTs and your X-rays. And for those of you that are out there like, oh, I'm feeling fine and everything is all right, some of these things that I showed you may not cause a lot of pain, or it may cause a lot of pain initially, and then it may clear up and it may seem like everything is fine, but you need to get yourself checked out. You need to get an MRI, a CT at best, or at least, get some X-rays to find out what's going on inside your body, give you the clarity and the answers that you're looking for, try to match up your symptoms with what's going on so you'll know what you need to do in order to recover and to heal and to get on with your life. So I didn't say before, my name is Anthony Wade. I'm a physician assistant. I think I did say it, but no, this is what I do. I love to go over MRIs and explain things to people. It bothers me the most when people have gotten the information that everything is all bad, or you really need some help with what's going on. And a lot of times it's really not the case. It's not that you don't need help, but it's not as bad as they make it sound. So again, if you need that clarity, you could reach out to me. But my goal here is to give you some information about what things should look like or what things should not look like. So I pray that this has helped you in some kind of way. Again, reach out to me if you need any help, and I'll be here to serve you. So I hope, like I said, I hope this has helped you out in some kind of way. In our next video, we're going to go over some of the things that you definitely don't want to do when it comes to MRIs. And I hope to see you on that video, and I'll talk to you soon.